Good evening, all. As you know, September is Blood Cancer Awareness Month, and looking as a pharma player, we are just spreading awareness regarding blood cancer. And Dr. R.K. Choudhary, he is helping us to spread awareness regarding the same. So today's speaker is Dr. R.K. Choudhary. He is Director and Head Medical Oncology, Metro Hospital, Delhi. So thank you, sir, for accepting our invitation for the same. So for our audience, sir, we just want to know what is blood cancer and what are the types of blood cancer.
So, namaste to everyone. Welcome to FP Live. So, thank you for the introduction. So, we'll start with the what is blood cancer and what are the types, right? So, as the name tells, blood cancer, any cancer which arises from the blood cell is called blood cancer. Specifically mentioning, there are three types of blood component that we need to be aware. One is the hemoglobin. Second is the white cell, also known as the total leukocytes. And third is the platelet. So we know about these three types. And the blood cancer arises from these white cells. When there is a dysregulation of these white cells at the genetic level, they'll multiply, they'll grow uncontrolled manner, and they'll spread to the different parts of the body, and that is called the blood cancer. So as a name, blood cancer is one, but if we divide them or if we subcategorize them, there are many types of the blood cancer. Commonly term used in the medical terminology is the leukemia for the blood cancer. So leukemia is not the one disease, but there are subtypes or many types of leukemias, lymphomas, myeloma. They comes under the bigger term of blood cancer.
Thank you, sir. So today's session is more focused on lymphoma. So will you please explain, sir, our audience that what is lymphoma and what are the types of lymphoma?
Okay. So when we talk about the lymphoma, lymphoma is basically any cancer which arises from the lymph node is called the lymphoma. And what is the lymph node? Basically, there is a system of lymphovascular system, a lymph node, and a lymphatic tracts. So lymph node are the normal बॉडी में हमारे इम्यून सिस्टम को मेंटेन करने के लिए छोटी छोटी सी गांठें होती है, जो कभी भी इन्फेक्शन के दौरान या किसी चोट के दौरान अगर आपने नोटिस करा होगा तो बगल में या गर्दन में कुछ कुछ गांठें हो जाती है, एंड दे आर बेसिकली लिम्फ नोड्स. एंड बिकॉज ऑफ सर्टेन unwanted mutations at the genetic level, the proliferation or the growth of these lymph nodes, the lymphatic system get disturbed, it get uncontrolled, and this results into the lymphoma formation, and that is called a lymphoma.
And sir, what are the types of lymphoma?
So broadly, lymphoma are classified into two categories. One is Hodgkin's lymphoma, and second category is, which is a bigger category, is called non-Hodgkin's lymphoma. So those lymphoma which does not fit into the Hodgkin's are called non-Hodgkin's lymphoma. Then this Hodgkin's lymphoma is further divided into four types, like mixed cellularity, lymphocytic predominant, lymphocyte depleted. Similarly, these non-Hodgkin's lymphomas are also divided into further subcategorization. So there are well classification, well set by the international guidelines. So this again, non-Hodgkin's lymphoma are divided into many subcategories. This classification is important for two reasons. One is to start with the which treatment suits for particular lymphoma, and secondly, this type of lymphoma also guides us about the prognosis at the beginning itself. So we can discuss the prognosis as well as the treatment depending on the type of lymphoma at the outset only.
So sir, if a patient comes to you, what are the general signs and symptoms of any lymphoma patient?
Okay, so when we come to the sign and symptom of the lymphoma, as I told you about the lymphoma, what is the lymphoma? Because this is a disease of the lymph node. So most common symptom that we face in the clinics that for the lymphoma are the swelling in the lymph nodes. And lymph nodes, since lymph nodes are part of the whole body immune system, so they can be found anywhere, most commonly in the neck or in the axilla or in the groin regions. So they'll come with the increased size of the lymph node, like lump in the axilla or neck, or maybe in the groin. This is the one symptom. Other symptoms may be associated fatigue, or maybe fever, weight loss, or sometimes since the lymph node lymphoma involves the immune system, so body's immune system goes down, and patient might have the recurrent infections. Sometimes the lymphoma also involves the bone marrow, so patient might have the low platelet, and that might result into bruises over the body because of low platelets, patches over the body, and maybe a low hemoglobin that might result in the fatigue. So these are the symptoms which commonly we see in the clinics. But if somebody is having this symptom, it is not necessary that he or she might be suffering from the lymphoma, because there are other diseases which can cause also similar symptoms. So don't come to the conclusion based on just these symptoms that somebody is having lymphoma, yes or no, because further tests are required to ascertain whether it is because of lymphoma or any other disease. Also, in lymphoma cases, what we call in medical terminology is the B symptoms. There are high-grade fever, significant weight loss, which is around 10% of the weight loss in the 6 months. That is called significance. And third B symptom is the drenching night sweats.
So, sir, when such patient comes to your clinic, so how you diagnose that this patient is confirmed lymphoma patient?
So when the patient comes with the symptoms which we, as a clinician, as an oncologist, suspect that might be because of lymphoma, two things are very much required. One is to properly diagnose the patient, whether he is suffering from lymphoma, yes or no. And if he is or she is suffering from the lymphoma, then we need to know what is the type of lymphoma, whether he is suffering from Hodgkin's lymphoma or non-Hodgkin's lymphoma, and further subcategorization of this lymphoma. And second thing that we want to know is what is the stage of that lymphoma. So type of lymphoma, stage of lymphoma, these both are required. For diagnosis, the biopsy is required. So biopsy means the taking the sample from the lymph node and sending it to laboratory. So they'll do the histopathology report, and for the subcategorization, they'll do the further investigation on the biopsy, which is called immunohistochemistry. So in short, we say IHC. So IHC will tell us what is the type of lymphoma. Then to stage the disease, we need to do the scanning of the body. Most commonly scanning used in today's clinical practice is whole body PET scan. It will scan the whole of the body and will tell what are the sites of the body where this disease is affecting. Because lymph nodes are the peripheral systems, so we can palpate them. But there might be things inside our body also, and that cannot be seen clinically. So PET-CT will tell exactly what about the internal body. The third thing which we need to do in the lymphoma patient is the bone marrow test, because that is also part of staging system, whether particular lymphoma has reached to the bone marrow, yes or no. That will also impact the stage as well as the treatment, and also this will tell us about the prognosis at the beginning.
So, sir, there must be some patient who are asymptomatic. So, for such patients, are there any screening tests?
Okay, so what you mean to say, is there any screening method to diagnose the lymphoma in the asymptomatic patient? So what we mean by the screening is to apply the test in the population which are asymptomatic, so that we can diagnose the disease in very early stage. So lymphoma as such, there is no screening method available.
So once the patient is confirmed that patient is lymphoma patient, so are there any treatments, and what are the treatment options for the patient?
Okay, so once we diagnose the lymphoma, as I told you, we subcategorize the lymphoma. What is the subtype of the lymphoma and what is the stage of the lymphoma? So once the lymphoma is diagnosed, stage is found, then we decide the line of treatment. Most commonly treatment used for the lymphoma is the chemotherapy. So there are various type of chemotherapy, and when I say chemotherapy, people need to understand what is chemotherapy. So basically, the medicine used to treat the cancer is called chemotherapy, and it is given in a similar way the other medications are given, like either with the injection or with the tablets. So depending on the disease, depending on the cancer, whether this cancer is amenable to for the treatment with the tablet, then we'll give the tablet. If it is not amenable to tablet treatment, then we'll give the injections. So injections of anti-cancer medication are called known as the chemotherapy. So most of the lymphoma are get treatment with the chemotherapy, and sometimes if there is a bulky lymphoma, we might use the radiotherapy in addition to chemotherapy for the treatment of the lymphoma. Normally, we start with the chemotherapy, give 3 to 4 cycles of chemotherapy. We do the interim response assessment, whether how patient is responding to treatment. Depending on the interim response, we'll decide further line of chemotherapy. Most of the lymphoma patients do much better than the other cancers. When we talk about the carcinomas versus lymphoma, lymphomas respond beautifully to the chemotherapy, and most of the patients get very, very good results.
Great to hear that, sir. So, sir, with such type of treatment options, are there any side effects with this treatment? Because it is a common question from patients.
That's very really nice question, because when we are sitting in the clinics, and we as a oncologist face a lot of challenges during treatment of the lymphoma, because once we diagnose the lymphoma, and if I say to patient or patient's family, okay, it is a stage 3 or maybe stage 4, so patient take it with a now it is the stage 3 or stage 4, it is advanced disease, and we have accepted he is not going to get cured. But it is not the case with the lymphoma. As I told you, because the lymphoma, even in the stage 4, are curable. And specifically, I talk about the Hodgkin's lymphoma. We might give the chemotherapy to any very sick patient because the responses are beautiful, and a patient might live longer after the treatment. So, patient and family not accepting the treatment for a lymphoma is very painful for the clinician, because we know as a doctor, as an oncologist, because this patient who is suffering from specifically the Hodgkin's lymphoma, he is going to respond beautifully. The results are very good, but the patient take the lymphoma advanced stage as like any other cancer who's like stage 4. So there are really challenges when the patient of the lymphoma refuses or questions the treatment. So we need to convince the patient, we need to convince the family, and yes, there are certain side effects of the chemotherapy, even with the lymphoma, but we need to weigh the benefit with the risk factors. So what are the benefit of the chemotherapy? This is what are the adverse effects of the chemotherapy. If I'm seeing the response are so much high and side effects are less, then definitely we need to go with the treatment. And in the lymphoma, most of the side effects with the chemotherapy are manageable. They are not such a severe, not a long-term side effects. Most of side effects are reversible. Once they stop the chemotherapy, this side effect will get reversed.
So, sir, you said that the outcomes are very good in lymphomas. So, our audience would like to know, sir, what are the survival rates for lymphoma?
So it's a very, very crude question, I would say, because as I told, lymphoma there are 10, 20 types of the lymphoma. So depending on the type of lymphoma, then there are 4 stages. So like stage 1, stage 2, stage 3. So type 1 lymphoma with stage 1 is having different results. Type 2 lymphoma with the type stage 2 or stage 3 has a different results. So there are many subcategorization, but overall lymphoma, specifically Hodgkin's lymphoma, do wonderful. if I say stage 1 or stage 2 Hodgkin's lymphoma, 5-year survival rates are more than 90-95%. So which is very, very good or very, very increasing results.
That is very good number, sir. Thank you for encouraging our audience, sir. And sir, as far as patients are concerned, there are some common questions like, is this treatment OPD treatment or IPD treatment? Whether patient will be able to go to workplace or school during treatment?
So lymphoma patient, since the lymphoma is a disease which can affect all the ages, starting from the younger age to the elderly, like the Hodgkin's lymphoma, which comes in the younger age, non-Hodgkin's slightly older age. So depending on the patients, again, which lymphoma, what age, what stage, and what resin I'm using. So some patient will be able to attend their office on the same day or maybe on the next day. And in the elderly patient, if they are in a poor general condition, I would suggest to have a rest after the chemotherapy. But normally this chemotherapy requires IPD admissions, if not one day, then at least for the daycare, since morning to evening. Certain type of patient who require 2 or 3 days of chemotherapy might require the IPD admission for 2 or 3 days.
And sir, what diet plan should patient follow during treatment and after treatment?
So normally we recommend the high protein diet during the chemotherapy. So because the most of these patients have the low protein also, and that their demand for the protein increases. So we recommend high protein, homemade, fresh food, and we suggest not to eat any raw foods like fruits, salads, and juices. We would like patient to avoid those things.
So that's it from my side, sir. So any final concluding remarks for our audience, patients, and caregivers, sir?
So I would like to give a message to all the listeners. The lymphoma is a disease which can be easily diagnosed if there is a lump in your body, in the neck, in the axilla, and if you are feeling like feverish for quite long, where there is a weight loss, if there is a night sweat, you must visit your nearest oncologist, get the test recommended by your doctor, and if somebody is diagnosed with the lymphoma, please start the treatment on time, because treatment started on time will give the very, very good results. Don't get afraid with the side effects, because the side effects of the treatment are reversible side effects, not very serious. They are manageable side effects. Thank you all. Thank you all the audiences.
Thank you, sir. On behalf of Lupin, I would like to thank Dr. K Choudhary for helping us to spread awareness regarding blood cancer and lymphoma. Thank you very much and good night, sir.
Right. Bye-bye. Take care.
Bye, sir.